Welcome back to Vet Chats with real-life veterinarian Melitza. Today we're going to be talking about pain in our pets and how diagnosing pain specifically is very difficult since our dogs can't talk to us. Our dogs can't vocalize if they're in pain and where the pain is. So it's up to us to notice subtle changes in behavior since that is the only way that we can diagnose. Like one of the conditions that affects many of our pets, especially into old age, is arthritis. Can you tell us about some of the signs, how we can tell if our dog is developing arthritis or if they're developing any pain at all?
Yeah, so for arthritis, you may notice your pet has a hard time or is really slow getting up after resting or sleeping. You may notice that they don't come to greet you at the door like they used to. You may notice, they can't jump up on the bed or they can't jump up in the car like they used to. So some subtle things like that can be indications that they are in some discomfort.
But the most important thing is keeping records and recording when your dog's behavior changes, in what situations your dog's behavior changes, and keeping track of it so that you are aware if there are any subtle points of pain. It is important to do a full physical checkup with your vet before beginning any training or behavioral modification profile. It is vital that you are keeping track of your dog's behavior, all the non-problematic behaviors, as those can be more indicative of pain than some of the tests that could be run. Might miss it.
And you know your pet. You see your pet every day. You know your pet. You know your pet much better than your vet knows. So a thorough history from the owner is very important.
Sometimes pain can impact behavior in ways that you don't even realize. So if your dog is developing signs of arthritis, they may be very avoidant of other dogs. First of all, they might be very avoidant of people touching them. If you are noticing your dog reacting to being picked up, maybe rough play, or eventually maybe even being touched at all, that could be very telling that there is some pain, inflammation, something else going on, maybe something digestive if they don't like being picked up. But they also might avoid other dogs. It's a lot easier for a dog to be really loud and really barky and scare other dogs away, and it's better for them than to have an excited dog come up and play with them, possibly knock them down, and really cause a lot of pain. Other pain can just affect your dog's mood in general. I know that when Sweetie had a UTI, she was being very mean to my other two dogs just for existing, pretty much. But when the accident started happening in the house and I realized there was really something wrong, she did have a UTI, we got her fixed up with antibiotics, and her behavior went back to normal how it is with my other dogs. What are some ways we can manage our dog's pain after an injury or if they're developing arthritis?
So a really important factor for pain management is weight management. So not only is being overweight extra force on the joints, but fat itself is inflammatory. So by reducing excess fat in the body, we can reduce extra inflammation in the body. So that can help with pain. Physical rehabilitation can be very important. So ensuring that our pets have a normal range of motion in those joints, are using those joints properly, and are maintaining muscle mass and strength in those joints is important. There's some nutraceutical options. There's lots of supplements out there. The ones that appear to have the most robust clinical information that they can be helpful for anti-inflammation and pain would be things like omega-3s and green light mussels. There certainly are other supplements out there. If you find that they help your pet, that's great. Another pain management modality that is becoming more popular, the information on it is more anecdotal, would be something like CBD products. I have had a lot of owners tell me it's really helped their pet. That might be something you want to try. I would say it's a use at your own risk kind of product. Other products you can consider that are more into the pharmaceuticals would be things like non-steroidal anti-inflammatories. They can be very helpful for injuries and arthritis because anti-inflammatory arthritis and injuries are typically inflammatory issues. So those can be very helpful. There are anti-nerve growth factor injections, which can be very helpful for things like osteoarthritis in dogs. There are the polysulfated glycosaminoglycans, which can be helpful for dogs with arthritis. For dogs with chronic pain, sometimes we'll add in medications like gabapentin or amantadine in addition to other pain management options. Those can all be good things. But I'd say definitely the cornerstones of pain management are weight management and physical therapy. And then for dogs that need additional pain management, those other options can be very helpful. I'd say some people are a little bit hesitant to start on these medications, but typically it is going to be of the most benefit to your pet to start sooner rather than later before it becomes a chronic pain issue.
Another really important part of your dog's pain management is keeping track of what's working and what's not working. So keeping up with that history, noticing their behavioral changes. So if you were concerned because they were sensitive to touch or they weren't moving around as well, keep track of how something has improved or how something hasn't improved. What would you say with the turnaround time that we're looking at for some of these medications? Like, how long should you be expecting to see a change?
So for something like the anti-nerve growth factor injection, so something like Librela, we know that it can take up to a week to see an improvement. So if we're 2 weeks after the injection and you haven't noticed a change, maybe that's not the right medication for your pet. For things like the polysulfated glucosaminoglycans, some protocols you'll do 4 injections once a week for 4 weeks. If after that 4 weeks you haven't really seen an improvement, maybe that's not the one for your pet. For the anti-inflammatory pain medications, those do tend to work a little bit faster. So if you don't notice an improvement within a couple days of being on that medication, maybe that's not the best option for you. Another thing that I forgot to mention that kind of goes hand in hand with weight management and physiotherapy is exercise modification. So most pets that have something like osteoarthritis are going to tolerate shorter, more frequent walks compared to one great big long walk. So instead of going for a full hour all at once, try breaking those walks up into 2 or 3 15 to 20 minute walks. That'll usually be a little bit better tolerated. Other exercise modification would be, if you can, taking your pet swimming, talking to a canine physiotherapist and using the underwater treadmill, or things like even switching from walking on hard pavement to walking on grass can be helpful.
Thank you for your time, Melitza.
You're welcome, Lila.
We really appreciate your advice. Toodaloo.